My name is Dr. David Eric Nkusi. I'm a Chief Medical Specialist in the Department of Medicine in Kenyatta National Hospital, and I am also the head of this AIDS control unit.
My name is Evelyn Macau, working in ACU KNH, that is AIDS control unit.
I'm still not Jen Monday. I am a nurse by profession, but in ACU I'm working as a program officer and ACU secretariat.
I'm Joyce Rono, HS Council. I'm working at Kenyatta National Hospital, Department of AIDS Control Unit. Okay, I'm doing HS service, HIV testing and counseling to staffs and their dependents.
What is unique about the Kenyatta National Hospital AIDS Control Unit is that matters of HIV prevention, HIV health promotion, HIV care, treatment and support are provided within the context of a hospital which does the same for the general public. This is a public institution and anybody else who seeks services here. But the specificity of the KNH ACU is that it targets its staff.
Apart from doing the HIV work or HIV prevention, we have been also incorporated to do UHC, Universal Health Coverage for staff, their dependents, and other stakeholders.
As of a few months ago, the total staff of Kenyatta are 4,700. Now, if you consider that we're dealing with the HIV issues around that, and we deal with matters of staff and dependents, even if you were to average maybe 2 or 3 dependents per member of staff, you know, you'll very easily be dealing with the health of about 20,000-30,000 people. So it's a very significant population in and of itself, the mandate of the Kenyatta National Hospital ACU. It eventually got established very specifically because initially, you may be aware, HIV, VCT and HIV prevention has been going on in Kenyatta National Hospital. We're actually very much a pioneering unit as far as HIV and hospital, as far as HIV prevention care and counseling support is concerned in this country. Way back 2002, the government determined that it is extremely important to actually take care of your healthcare workers. Take care of your healthcare workers, then they'll be able to take care of others. Makes just that much more sense. The healthier they are, the more they're able to provide the different healthcare messages, the different treatments, the kind of care and support that are expected of the outside. And so the government insisted that KNH must establish that.
Our core mandate is to screen staff for non-communicable diseases, that is high blood pressure, high blood sugars. We do a cancer too. We do a mental health screening. And when we find staff are living with these conditions, we refer them for further management.
So, as an ACU, we have also been working very closely with the National AIDS Control Program, participating in some of its committees as various aspects of service delivery, policy development, interventions, and all sorts of things are concerned.
And the screening we do is in form of a questionnaire. Yeah. So we do cancer screening, we do mental health screening, we do sexual and gender-based violence screening in form of a questionnaire. We link up with other units and departments such that if we get a staff at risk or we suspect to be having one of the maybe cancer, we refer to either Clinic 66, Clinic 18, Staff Clinic. We also work with oncology department.
Sensitization and screening around issues of blood pressure. People need to be much more sensitive about their blood pressure. It's a trigger for all sorts of diseases, whether it's stroke, kidney problems, and all sorts of things. We were also interested in their BMI, so we're interested in their weight as well, because a BMI index does give you an indicator as to how healthy you actually are in the first place. Your weight-height ratio, okay? Your basic metabolic index. Then we're also interested in blood sugar. Diabetics, once again, very, a significant proportion of our populations are diabetic. Right now, the National AIDS Control Council talks about achieving MISHA 1 certification and MISHA 2 certification. MISHA 1 certification is being able to do some basic HIV prevention, care, treatment, support services. In MISHA 2, you do an added level of being able to do the same thing. We have been going around the different departments of the hospital. We have 47 plus departments. We go to departments, we sensitize them, and then we have them come in for screening. But working in conjunction with the National AIDS Control Council, we have also been able to work with other government agencies and also take them through the same kind of things. We've been able to develop a modality of how the ACUs, the different ACUs, can actually work towards delivering screening and sensitizations and screening for all these parameters that I've talked about. Again, the message which we really are trying to spread over and over again, and we emphasize this, is that preventive health is extremely important. We as individuals need to take responsibility for our health. And in order to do that, we need to have a baseline. Who are we? What is our health status as it stands right now? And the better information that we have as a result of one, sensitization, as a result of two, screening, the better we are placed to start planning for a healthier life.
We welcome all staffs and their dependents to ACU to come for these screenings: cancer screening, mental health, and gender-based violence, among other screening.
We welcome you all. Please come to us, and it's going to be the same. Feel welcome to our unit.
We are doing sensitization, we are doing screening for universal health coverage indicators. This includes your blood pressure, we check your weight, we check your height, we do a BMI, which is an index of how healthy we actually are. We screen for mental health, we screen for cancer, and these give us an idea about how healthy we are as individuals. And I'd really like to encourage all of us to come to make an appointment, to come to the particular unit and actually get sensitized. We're scheduling the different departments to come in on a weekly basis. And so we'll be able to actually give you very specific timing to actually come in so that you are not going to be in a crowded environment. We are reducing our COVID risk as much as is possible. But again, we're also balancing that with the need and importance for everybody to have an indication, an idea of their own health status, which is really much very important. So please come, get screened, bring in your dependents, and let's be as healthy as we possibly can.